They're giving us already. Hello and welcome to Benefit News. You're here with me, Marilyn Gore, and we are on the Wellness Benefit Podcast. Today we have with us Dr. Rutul. He's a nephrologist practicing in Ahmedabad, and we'll be looking at the complications arising from diabetes that affect your kidneys. Thank you for joining us, Doctor.
Thank you.
Let's just dive right into this.
Yeah.
What does diabetes have to do with the kidneys?
Yeah, actually diabetes is a condition which affects many parts of the body. So basically what happens that there is a rise of sugar in the blood which goes through many organs. One of that is kidney. And while it goes to kidney, the balance of the kidneys gets disturbed because kidney is acclimatized to work at certain level of glucose. And if there is a up and down or if there is a rise, then it will create some of the activities which are not natural to the kidney, and it will create an inflammation.
So, I mean, tell me if I'm wrong. It's like having a sponge that has absorbed too much liquid.
Yes.
And then after that, the liquid stays and it doesn't do its job properly. That's what we're saying?
Yeah.
Okay. All right. Now, I just wanted to clarify.
Yeah.
Please continue.
So, like that, if it goes down too high for too long, then it will start affecting the activities that are happening in the kidney, and it will generate some of the redox products that will create inflammation inside the kidney. And at the end of inflammation, there is a loss of tissues in the kidneys, which will give rise to the picture of chronic kidney disease due to diabetes.
Okay, so what happens there?
In such patients, what you get is it starts with the loss of protein in the urine.
Is that why we test for creatinine on a regular basis?
Yeah.
Okay.
We test for protein in the urine. So naturally kidney is meant to conserve the protein from the blood, protein from the blood, and back into the blood, and push the creatine outside the body. But what happens is that kidney starts leaking the protein.
Okay.
And then on it progresses to a level where it does not function properly and does not remove the waste products properly from the body. One of that is creatinine. There are other waste products also which can give other symptoms, but we generally measure creatinine because of it's more reliable to measure the function.
Okay. I know we've gotten way ahead. We'll pull this back a little bit. Suppose I have been diagnosed with diabetes.
Hopefully
okay,
it's
so
not.
No. So I mean, just as it's better than saying you. So, what should a diabetic patient be looking for? Like, how do we know we're going towards problems with our kidneys?
Yeah, initially when you are diagnosed with diabetes, the doctor will put you on certain medication. He will carry out certain tests. All of which might include kidney tests also. Suppose if you are on medicines and if you start experiencing new symptoms like swollen feet, frothy urine, or if you start developing hypoglycemia or hypoglycemic episodes frequently with the same medicine which were earlier controlling or were not able to control but the diabetes. Or you start developing hypertension of new onset. Previously you were normal blood pressure and now you are having hypertension. So these are a few symptoms which can suggest that there is something going on with the kidneys. And for that you have to do the testing to find out if it is.
So you mentioned creatinine. Is that the only test that someone should be regular with?
I think first you should check for urine for microalbumin.
Okay.
But now it is been suggested that you test urine albumin creatinine ratio, which measures albumin in the urine as compared to creatinine in urine.
Okay.
So that gives a more clear picture of the efficiency of kidney to remove waste as well as preserve protein.
What do these two things do in our body? Just to clarify?
Protein is
No, I mean these specific these are both proteins, right?
yeah.
So these specific proteins, do they have a specific role, or do they just
The protein is a structure which helps to provide nutrition to the body. It makes most of our muscle mass, and it is used in many of the metabolic actions of the body. Simultaneously, creatine is the end product of the metabolism of protein. If you divide protein
okay?
and in the end, and if you use it up, and whatever stays in the end, that is the waste products, that is creatinine.
Okay.
So function of the kidney is to conserve protein back to the body and send creatinine outside the body.
And what does albumin do then?
Albumin is one of the protein.
Okay.
So it keeps some of the elements into the blood. It is a protein of the blood.
So when you say this ratio, you're testing for this ratio, should the ratio be high or low?
It should be low.
Okay.
It should be less than 30.
Mhm.
If it is more than 30, then it suggests there is a early changes of diabetic kidney disease.
Okay. And once you've identified this, is there any way to go back or to slow it down?
Well, we can definitely slow it down. Whether to go back or not, that depends on the timing, but you can definitely slow it down.
Mm-hmm. So you mentioned that there will be new symptoms. But suppose somebody doesn't have the symptoms, but their sugar is slightly high on a regular level. So how high does your sugar have to be for this to happen?
Mostly what guidelines suggest is that fasting blood sugar in the morning before you eat your breakfast should be less than 130,
Okay.
and after 2 hours of meals the blood sugar should be less than 180.
Mm-hmm.
If that is the range, mostly you are in a controlled range.
Okay.
If it stays more than that continuous basis, then chances of getting end organ damage to kidneys as well as heart and brain are higher. So that should be the target for diabetic patients.
Okay. What are the chances for an average person who's, say, taking medicines but not really making any other changes in their life?
I think lifestyle changes are of paramount importance in the management of diabetes, because whatever medicine you are consuming is going to act if you are following that discipline. If you are not maintaining your weight, if you're not having a healthy lifestyle, if you are not being active, then all the medicine will eventually stop working at certain level.
Mm-hmm.
So then you will be left with more problems.
Like in a previous episode with Dr. Yogesh Gupta, we were talking about how the kidneys also filter out the medicines that act on the kidneys themselves. So does this have anything to do with say kidney issues later? Because a lot of people are worried कि दवाई लेंगे तो फिर kidney में असर पड़ेगा. So is there any truth to that?
You have to check your kidney function, and if it is abnormal, then you have to modify those medicines.
Mm-hmm.
But there are evidences that some of the medicines for diabetes, they are very much useful. So while if you don't have kidney disease, then you can take benefit of those. Once you start developing kidney related issues, then you have to meet the nephrologist and modify those medicines. But there is no particular medicine which you can say that this will affect this of diabetes per se, that will definitely affect kidney disease.
Okay, I was reading up obviously, and I came across this term called diabetic nephropathy. Sorry, can you just go into a little bit on that, please?
Yeah, diabetic nephropathy is basically diabetes-related kidney issues.
Okay.
Actually, it was an old term. Nowadays, we use diabetic kidney disease because it is
Simpler.
easier to understand, and it encompasses very core of the diabetes related kidney problems.
So are there a lot of diseases that come under this one umbrella?
Yes.
So like
previously it was thought that you have a straightforward course of diabetes related kidney disease, like you first develop proteinuria, then creatine starts rising, and then you end up with kidney dialysis and all those things. But nowadays there are various presentations which are different from the classical presentations, where you get only rise in creatinine. You might not develop proteinuria at all initially.
Okay.
Then there are some people who are having very rapid progression.
All right.
So what now we think is that when you are diagnosed with diabetes, you have to be wary of your kidney health, because sometimes people may have one kidney.
Yeah.
So they are.
That was actually going to be my next question.
Yeah. So if they are by birth having only one kidney, so they will be exposed to more insult than as compared to those people who are having two kidneys functioning well. So to address these problems, we have moved to this term diabetic kidney disease.
Speaking about people with one kidney, what if you develop, again I'm saying you as a generic term here, so if someone develops say diabetes after donating a kidney, how does this affect this person? Is it extra serious for them, or how does it work?
Well, if you have one kidney,
it's the same thing?
No, it is not the same thing, because if you have one kidney and if you develop a diabetes, then it will create more. It will hasten the damage, fasten the damage to the kidneys.
No, I meant as opposed to somebody who's born with one kidney.
Yeah.
So in that case, like if suppose person A is born with one kidney and person B has given away one kidney.
Yes.
Or donated one.
Yes.
So in that sense, is there a difference in how this reacts?
No.
Okay.
It is pretty much that you have to take care of your diabetes, otherwise it is going to progress at a rapid pace.
So you're telling me that all diabetic patients need to watch out for kidney disease?
Yes.
I remember we were talking one of our previous episodes again. We were talking about how...
I hope I'm not sounding...
fatalistic. Little bit scary, but I think that's important in this case, because the subject we're dealing with is pretty scary.
Yeah.
And from what I was talking to Dr. Yogesh about earlier, we were talking about how many people in India have diabetes. And I think the numbers are increasing every year. So therefore, I think it becomes very important that we, scare people a little bit into improving their health and lifestyle.
Yeah, sure.
We were talking about stages, right? You said that you can't reverse kidney damage, but can you slow it down?
Yes. If it is a chronic kidney disease, that is a long-term kidney-related problems due to diabetes. So it is by nature, by name, it is a chronic.
Yeah.
So you are supposed to have a gradual progression, and what your job is to do some things which can slow it down, which can prevent its progression to end-stage kidney disease. Otherwise, if you expect that your age might reverse, that is not going to happen. So take it like this.
Lifestyle changes as in, I would assume, more exercise.
No, I mean there is nothing like particular more exercise, but if you can do general exercise, 30 minutes of daily activity, 150 minutes a week, if you control
that is
your
like,
diet.
I think the WHO norm for basically.
Yeah. More than that, I don't know if there is a benefit, because what they have shown is that this is the norm which you can get, where you can get maximum benefit. If your body allows you to do more, then it's fine. But
that's a minimum.
Yeah. And while doing exercise, I think people nowadays consume some supplements.
Yes, there's protein supplements.
Supplements, creatinine and anabolic steroids.
And also artificial sweeteners. We were talking about that before we started here, right?
Yeah.
So can you tell us a little bit about that?
Yeah, artificial sweeteners, they are used to,
Excuse me.
Yeah.
Yes, please.
Yeah, artificial sweeteners are also a product which can generate some waste products that can damage the kidney eventually. So when you are diagnosed with the kidney related disease due to diabetes,
I'm so sorry, please.
Yeah. So then it will have an adverse effect on kidneys, because some of these sweeteners, they contain fructose, so which will metabolite to uric acid, and that will have an oxidative damage on kidneys.
All
so better to take the regular sugar in lower amount.
So you said fructose. Is that the fruit sugar? Or is that fructose or something else?
It is one of the compound that is similar to glucose, but it is not as simple as fruit sugar.
I'm sorry. It's been a little bit of a hassle today.
Yeah.
All right. Is there anything else we can talk about?
I think we can talk about the end-stage kidney disease, diabetic patients. People who are diagnosed with diabetic kidney disease, if they progress to end-stage kidney disease,
Yes.
they can, have an option. Generally, there is a first step is to do dialysis. So dialysis are of two types. First
Okay.
is the hemodialysis, which we do with the help of a machine where blood passes through a filter
Yeah.
and comes back to the body after getting cleaned from the filter. So the waste products gets removed. Second is peritoneal dialysis, in which you insert a catheter inside the abdomen and you hang the bag and get the material inside, get the fluid inside the bag into the abdomen, keep it for 3 to 4 hours, which will exchange the waste products. So the waste product that is generated inside the abdomen will come out in the after 4 hours into the waste bag. So that is there are two options of dialysis that you can go, and the second is the kidney transplant, where which will partially reverse your kidney function. With the help of medicine, you can maintain those kidney function, and you can avoid the dialysis.
Yes, I'm really sorry about that again.
Yeah.
It's just been that kind of day.
Yeah.
Sorry, before we close, this is one more question. We're talking about transplants and dialysis. How likely is somebody with diabetes to be able to get a kidney?
Well, if you have diabetes, obviously family members who are not diabetic, they can give kidneys.
Okay.
And second option is to register in a cadaver program where you can get kidney after you are being called when your chance comes. Overall, the benefits of a kidney transplant in diabetes are more or less similar to those patients who are not diabetes. But some of the medicine of kidney transplant may exaggerate the diabetes.
Okay.
So you have to be careful about your diabetes control even after the kidney transplant. And those who are on diabetic patients who have undergone kidney transplant, there is a higher risk of getting infections compared to the routine patients.
All right. That's been a very insightful conversation. I'm really sorry about the interruptions. If you have any questions, do message us on the number given below. For those of you who are joining us for the first time, that is 9081444909. Messages, calls, and of course, because we are on social media, you can leave us a message. Send this to somebody who might benefit from it. If you have anything more to, if you want us to answer any other things, talk about anything else, because next week we'll be talking about
Neurologist.
We'll be talking to a neurologist. So because this is one of the 4 things that the major complications with diabetes. So in the meantime, don't forget to like, share, follow. You know the drill. For Benefit News, this is Marilyn Gore.